Welcome now to the Chief Executive Officer of Lymphoma Australia, Sharon Winton. She's a member of the Lymphoma Coalition, and she's been a consumer representative on a number of stakeholder groups in Australia and internationally. So welcome to you. I'll give you the deaf sign welcome. We had a chance to speak earlier, and we're going to talk about what you think has improved in recent years and what are the priorities of what still has to be done. But just before we get to that, you passionately believe that patients need to take action to inform themselves, that power comes with knowledge. Will you speak to that? But also, in reaching out to learn more, how do you avoid misinformation once you get into the world of the internet or the patient group where not everything may be evidence-based?
Exactly. And thank you so much for that question, because definitely for patients and everybody, knowledge is your power, but you can't let it overwhelm you either. So when you are diagnosed with CLL, you do actually need to know what it is, but you also need to remember that it's going to be unique to you. So that's why we're saying you need the knowledge about your CLL, not just CLL in general, because if you just went and Googled CLL, what you might read may not have any relevance to you at all. So to your question then, how do you then decipher all of that? Yes, that can sometimes be difficult. And I think even Peter would say, don't just Google, because that's scary. But go to organisations that are trusted sources of information, like the Lymphoma Australia, Leukemia, the Leukemia and Lymphoma Associations in the UK. Ask your treatment team, where can you go? And also what we're seeing now globally is this connection between patients and everybody through online forums and everything else. Again, they're great ways to connect, but be mindful of what you are reading and taking in sometimes.
Yes, I think when I have been a cancer patient myself, and when I said to my team, what website should me or my friends look at and what not? And I took that direct guidance. But let's go to some of your key messages. You say that what has improved, and we're talking obviously here about Australia specifically, but there are more treatment options approved by our pharmaceutical benefit scheme, the provision of cheap or free medications. And those greater treatment options are the result of research and clinical trials. Can you speak to that, the good news?
Yeah, look, definitely. As Peter said too, a decade ago, what a CLL patient would have been treated with is entirely different to what we're seeing today. And that's been the result of research, genomics, clinical trials. And the good news then for the CLL patient of today is that there are treatment options that are available to you that we've never had before that are extending lives. And within Australia, and the same with the UK, I think we've been very fortunate that we do have health systems that have brought through the ibrutinibs, the acalabrutinibs, the venetoclax, even though it is in the relapse setting. But then listening to Peter, it's great these trials are now pushing it into the frontline setting as well. So for a CLL patient, what you've got today is great. What you need to know, though, is what is relevant for you individually as opposed to everybody, so that you get the right treatment sequencing for your CLL. And that's that knowledge piece that I was speaking to earlier as well.
And you also said the good news is that there are more treatment options, and that's leading to better survival.
Well, yeah, you can actually, we know what we're doing now a lot better. So even with the diagnostic side of things, and this is what part in Australia where we are lacking a little bit, we've got the diagnostics and the testing that can help guide the treatment decisions, but we don't have it all funded yet in Australia. So we have an inequitable access to that. So to the Australian patients here, make sure you are asking to be tested before you are treated, because it doesn't always happen. So ask what test you're having and then ask what the answers are as well.
You've raised this issue of equity of access, and I don't know if we want to get a comment from Peter later. I'll leave that to Catherine. But your feeling is, in the Australian context, despite our universal health coverage, that there is a difference between public and private patients or locations of where you live or don't live? Like, where does the inequity come in terms of access to the right test at the right time?
Testing is your diagnostic, so it's things like your fish test and that. So we don't have it funded yet in Australia. I'm not too sure how it works in the UK. So it may mean that as a patient, you need to know that a fish test could be relevant for you, and you ask the clinician. So that's that knowledge piece that will then help with the treatment. So we've got some inequities there. Once a treatment is approved under our PBS, then it is becoming equitable, but that's when it's the knowledge of knowing the sequencing of treatments for you. It's up until the approval process in Australia where you would want to be looking at your clinical trials, and COVID has probably been a bit of an impact now as well. It's like once upon a time we might have travelled a bit further for a clinical trial, whereas now we'll stay closer to home and we might miss out on some of those treatments. So there's that potential inequity there as well.
And that's another key concern of yours going forward, isn't it? About providing accurate and more accessible information about clinical trials to patients who may benefit from them.
Yeah, definitely. I mean, Australia, we've got geographical challenges. You know, most of our population along the East Coast, that's where we're going to put the trials. So rural, regional patients, getting that information. So for patients and everybody online here tonight, today, whatever it is, you do need to keep abreast of these trials. The ones that Peter were talking about are brilliant trials. Yeah. Can we bring them to Australia as well? We'd love to have those combination therapies, but yeah, we have a right to ourselves. We need to actually be looking after ourselves and sometimes advocating for ourselves, and that's needing that information.
Sharon, I want to come back with one more question before we go to open questions, but if I could come to Peter Hillman just for a moment and just say, do you have any issues at all about equity of access to testing and treatment in the United Kingdom, or is that not an issue with the National Health Service?
Well, in terms of treatment, the diagnostics, and that's moving rapidly. So in terms of sequencing of patients, which you know, understanding what genes are broken, and there are some things that actually affect treatment now, and others that are going to affect treatment going forward. We have a very good platform of diagnostics in the UK, and patients don't pay for it, so it's available generally. Although I think as Sharon said, the clinician has to ask for it and has to understand the importance of it. And not every clinician is a CLL expert. We have the advantage in both the UK and Australia is that we're managed by haematologists. And so at least they're blood specialists, not cancer specialists. I think that really matters as our diseases become much more specialized. So some of us just manage CLL, not lymphoma and other leukemias. And that's, so I think part of it is getting the right advice, and asking your clinician, you know, is there anybody else that you should get a second opinion from? And I find if a doctor says you shouldn't have a second opinion, then you're probably with the wrong doctor. I mean, I think, you know, you need to get that information. In terms of treatment, the advantage of our socialized system is that if it's approved, you get it, and that's good. So everyone should get, and it's not faultless, should get the same treatment. The problem is it's slow. So ibrutinib we've known has been a better treatment for the last, you know, frontline for many patients the last 2 or 3 years, and it's not approved, not funded yet. And so I think lobbying and there's two very good, strong groups in the UK for CLL patients. The CLL Sports Association and Leukemia Care are the two ones that are very prominent in CLL. A lobby with the government to get these things funded. I mean, advocacy is really important, and patients' advocacy is critical to make sure we have access early. We don't want treatment which isn't proven to be good. We don't want hydroxychloroquine for COVID. We want to prove it works, and once it's worked, we want to have access to it. And so I think the approach is right, but we need to keep the pressure up.
Sharon, just one last question, then we'll open up to all questions, and that is, just tell, for those in Australia, what do you offer? What does Lymphoma Australia offer patients and families with CLL?
Yeah, so with CLL and any other lymphomas as well, we want to be able to provide that support and information so that regardless of where you are living or where you are in your journey, you can actually come to us for help. And so we do have our lymphoma care nurses, as well as our website with all the dedicated information, our support materials. But education sessions like these are also invaluable for any patient with any disease, so that you can actually take that away and then discuss it with your clinicians. So these sorts of sessions are what we can offer as well.
Well, look, Sharon, thank you so much. I'll just give you the appropriate clapping. If you hit clap